The number of people with eating disorders seeking help has at least doubled this year, pushing treatment services to breaking point, according to a support group. The Eating Disorders Association says children as young as 8 are waiting weeks or months for specialist treatment for life-threatening eating disorders like anorexia. It's calling on the government to set up a specialist-led panel to investigate ways of providing better services and treatment for eating disorders, which have the highest mortality rate of all psychiatric illnesses. The association chair, Nicki Wilson, says the numbers needing help have skyrocketed in all age groups.
It really is at crisis point. We're really concerned. EDANs are a voluntary organisation. We have a support line where people ring us or send in emails asking for help, support, information when they have a loved one with an eating disorder. So what we're finding is, compared to this time last year, we have 4 times the number of calls to our helplines. Really busy, and we know that the DHB services are experiencing at least double the demand on their services this year, and private clinics, of which there are 3 or 4 in New Zealand only, are reporting 3 to 4 times what they have experienced, the same time last year. Really desperate, and people are having a long wait for treatment when they receive a diagnosis.
Right, so that level of demand, you've touched on it, but what is a long wait? What would be the ideal situation, and what is it in reality?
Eating disorders are treatable illnesses, and when somebody is diagnosed promptly and referred to evidence-based treatment immediately, and by immediately I think like any life-threatening illness, we're talking about very, very quickly, within a week or 2, then people become, the suffering is less, the severity of illness is less, the length of time that people are unwell is reduced, and they get better quickly. At the moment, people are waiting 6 to 8 weeks, up to, we've heard cases of people waiting up to 9 months to be seen in the DHB-funded specialty services for treatment.
And what is the fear there?
People are becoming very, very ill and actually ending up in hospital with in a life-threatening situation, and requiring far greater, obviously, intervention and length of treatment than would have been necessary otherwise. And obviously the suffering is enormous for the individual and also for their family. It's very, very difficult indeed. And it's unnecessary. The services simply are overwhelmed. People are working within them, are passionate and hardworking, and they just do not have the capacity to meet the demand. And we have been working proactively with the services, and we've had a meeting this morning with clinicians from the up and down the country, meeting to talk about solutions to, in the short term, to bridge the gap and find ways to alleviate the suffering and to get people into treatment more quickly. And long term, we are looking for a government-led review of services.
So are you telling me that lives are at risk as a result of there being insufficient services for eating disorders in this country right now? Yes,
lives are at risk. Lives are at risk, although people are being, one of the things that we are hearing is happening, that while people are waiting for treatment, and they're on a wait, and they may be as young as 8 and as old as 65 or older, they are ending up going to the emergency department, and it's at that point that they are being admitted into hospital for life-saving treatment.
Nicki, tell me about that, those ages that you just mentioned. 8-year-old, and then at the other end of the spectrum in their 60s. What? I know this is complicated, but 8 years old, what is driving the demand for services, eating disorder services for 8-year-olds?
Eating disorders affect people of all ages, all genders, all socioeconomic groups, nationalities. Eating disorders have always affected a cross-section of the community. So there is nothing new about 8-year-olds becoming very, very ill with an eating disorder. And I think that at the moment we are witnessing a larger number of people becoming ill. So we are seeing more of every age group, including those young ones. And because the services are stretched, they are becoming more unwell than they would have if the services were equipped to cope and to get in quickly.
Why has it got so bad?
We don't really know. We think that we know that the cases have been increasing over recent times, over recent years, and services have been becoming more and more stretched. There hasn't been a review for over 10 years of services, was the last time that the government looked at the provision. But particularly since COVID and lockdown, we have seen a surge. And we know that mental health conditions generally have worsened, and we think it's part of that. There's heightened anxiety and uncertainty. There's been a lack of structure and even connection during lockdown. Anxiety and depression have increased in the population generally. So it's the worsening of conditions in some people who are already unwell, and there are new cases either being detected and diagnosed or occurring.
Is it residential treatment that you need, or is it outpatient treatment?
Preferably it's outpatient treatment. If people are detected, if diagnosis is made promptly and people are referred to treatment quickly, the evidence-based treatment for eating disorders is family-based treatment. It's being fed within your community, within your own home, and just normalising life as soon as possible. So outpatient treatment is what we need.
Nicki, you say that you've been meeting with specialists, but what is it that you require from the government?
We are asking the government to review the current services and to understand that the current capacity, the resources that are in the DHB-funded eating disorder services are not adequate. They are stretched. Demand is not being met, and we would like to see that led by government. We think the Ministry of Health needs to review what is currently being provided. We made a submission to the mental health inquiry a couple of years ago, and we were disappointed that we didn't see any response to the problems that we were highlighting and some of the solutions that we were suggesting back then. They have not gone away, they've got worse, and we're asking for some attention to this situation.
So, Nicki, that's money, isn't it, that you're talking about?
It is. The workforce needs to be increased, and we need our GPs to receive more knowledge and education, and they need resourcing and support. They are crying out for help. They say they are telling EDANs that they are diagnosing a patient and then holding them and monitoring them on a weekly basis and watching them deteriorate over weeks as they're waiting for them to get into treatment.
And that's Nicki Wilson from the Eating Disorders Association.